So without further ado, let's get straight into it. Let's have a look at our Zedmed version 33 electronic prescribing. Now, I would definitely say that it's probably the major change of the year, electronic prescribing. It certainly has created a lot of discussion amongst the practices on what it can do, what it can't do, etc., etc. So hopefully this session will help you understand it in greater detail. But electronic prescriptions are definitely an alternative to paper prescriptions, which will allow people convenient access to their medicines. And it also lessens the risk of infection being spread in the general practice waiting rooms and community pharmacies. So changes have been made to Commonwealth legislation across all states now to recognise electronic prescribing as a legal way to supply medicine. This provides our prescribers and patients with the alternative to the traditional paper-based prescriptions, although they still will be available to you. Electronic prescriptions will not fundamentally change existing prescribing and dispensing processes. It basically will provide patients with a greater choice, and patients can still choose which pharmacy they attend to fill their prescription. The implementation of electronic prescriptions will help protect us and our patients from COVID-19. And I'm happy to announce that we were one of the first practice management software providers to provide this feature to the community. So I'm very, very happy with that. I'm not sure if everybody is aware, but there are actually two models that will be supporting electronic prescribing. Now, these are the token model, which some of you may have already seen, and the active script list model. Can I ask everybody to go on mute if they haven't already done so? So as I mentioned, there are two models, the token model, which some of you may have already come across, and the active script list model, which has not yet been released. Now, primarily due to the current COVID pandemic, the solution for the delivery of electronic prescriptions has been accelerated and has been available to selected prescribers from the end of May of this year. Now, these prescribers were essentially trialing the electronic prescribing function in what we call communities of interest. Typically, these communities were located in regional areas where we had a few practices and pharmacies that were e-prescribing enabled. And we use that feedback from these trial sites to supply the Australian Digital Health Agency with ways and improvements that were required before that program was more generally made available. So the feedback and these enhancements have all been included in the version 33 release, which we're looking at today. So if you have used electronic prescribing as part of the community of interest model in the past, using our version 32, it may look slightly different, but don't worry, we're going to go through these features that have been updated today. Just on the topic of community of interests, now, although e-prescribing or electronic prescribing has been legalized in all states and territories, it is only available in general release mode in Victoria, and that is primarily due to the stage 4 restrictions that are currently in place. So practice management software providers together with pharmacy dispensing software providers have really just focused the rollout of their software to Victoria so that we are in a position where most patients now have the ability to dispense electronically in Victoria. So in other states and territories, with the exception of Western Australia and Tasmania, e-prescribing is still available under the communities of interest model. So if you're a practice that is interested in participating and you're aware of a local pharmacy that has the capability to dispense electronically, just let us know, let Zedmed know, and we will certainly assist you in forming a community of interest and providing you with the software that's required. For Western Australia and South Australia and Tasmania.
Oh yeah, then I think I know what it is.
Can I ask if you're all on mute if you're participating, please? I can hear you talking. For Western Australia and Tasmania, although e-prescribing legislation has passed in these states, we're awaiting for those state governments to advise us of their state-based specific requirements so we can modify our software to suit. So once we receive that requirement, we will certainly be in a position to roll out e-prescribing in those two states as well. So let's have a closer look at the model of electronic prescribing that is currently available, and that is our token model. So patients will basically use electronic prescribing with the help of a QR barcode that they will present at a pharmacy to dispense their medication, and this is the model that has been available amongst our communities of interest since May 2020. A little bit later on this year, and we're aiming for, towards the end of 2020, more functionality will be available in addition to the token via our active script list model. Now, under this model, pharmacists will be able to access a patient's electronic prescriptions by retrieving the active script list essentially from a cloud. So the patient won't receive a token or a script. They will basically need to prove their identity to the pharmacy, and the pharmacy will just access all of those scripts that are available to that patient. So what the active script list is expected to do is overcome the issue of lost tokens and assist patients with medicines. So we can't wait for that model to come out later this year. Lots of benefits of electronic prescriptions. Naturally, there are less touch points, particularly in this COVID environment, so you can continue to fulfill scripts using telehealth. It also means that less people are traveling to practices, and that's certainly a major advantage. I'm going to go through these with you in Zedmed. It's probably easy to see a couple of the requirements that you will need to have set up so that your practice is enabled for electronic prescriptions. So excuse me while I go to my Zedmed. Alrighty. So let's start off with what your practice needs. And the first thing is that we need to have a HPIO. So if your practice doesn't have a healthcare provider identifier at an organizational level, it needs to be applied for and sought. Naturally, I would say that most of us have met this criteria. In addition to that, it's more around the individual prescriber level that where we need to have an individual HPII updated into the Zedmed system. Now, to check to see if that's been achieved in Zedmed, we basically just lost my Zedmed. Oh, there we are. Thank you. In Zedmed, we basically, in practice setup, look at our doctor's profile. So practice setup, doctors, find treating doctor. Once you've located your doctor, let's say Dr. Davis in this case, we can open up that profile and check to see if the HPII has been entered. Now, if that HPII isn't there, we can use the Search HI service to download it. If we've noticed that in some doctor profiles, the HPII has not been marked as searchable by the My Health record team. So if you ever are trying to upload a HPII for an individual doctor and you get nowhere with that, it is quite possible that you'll need to contact the My Health record team and ensure that the HPII for that doctor is marked searchable, because if it's not, you won't be able to progress. In addition to that, each doctor needs to be registered with either ERX or MediSecure. So if you're not participating in a prescription exchange service such as ERX or MediSecure, you will be unable to use electronic prescribing. The third thing that we need to look at And it's probably worth noting that electronic prescriptions are only available to patients who have an IHI, an individual health identifier. So typically somebody that is part of the Medicare system and has, so you won't be able to prescribe electronically for overseas residents or someone that has not supplied their IHI, excuse me. And they also need to be registered for My Health Record. The third thing I wanted to show you, and again, it's back in practice setup, doctor's profile, is that part of the enhancements to the electronic prescription, the actual script, is that we need to include in the doctor's qualifications. So if you haven't already updated the doctor's qualifications, please do so in doctor's details. The next thing I want to bring to your attention is if you are a doctor that has a specialty treatment, i.e. you might be a dentist or you might be a podiatrist, etc., you need to select your specialty from this drop-down box here where it says text for specialty treatment. Naturally, if you're a general practitioner or don't have a specialty, you just leave that blank. Okay, so once we've done updated our doctor's details with the HPII, the qualification and the specialty treatment, we can save those functions, we can save those updates and continue. From there, it's worth showing you how you enable the function at a practice level. Now, to do that, basically, you need to have the right authority. So typically we see that practice managers have this authority, but essentially it's anybody that has an administration profile set up in Zedmed that can complete this, this task. Now to do that, in clinical, we go to tools, we choose global options, and once we get to the global options screen, we select the drugs tab. And in the drugs tab, you can see here the electronic prescribing section. We ensure that that checkbox has been ticked for the practice. Now, by default, version 33, you'll automatically have that feature enabled if you're in Victoria. Because we are still operating in a community of interest mode for the rest of the country, it may be blanked out for you, because obviously it's not at general release. If you have been approved to act as a community of interest beyond Victoria, we will certainly assist you with enabling that. So enabling, ticking it enables it for the practice, unticking it naturally disables it for the practice. And you can see for this practice, which is just a dummy practice, we are using ERX, which has been selected here as well. So a new feature in version 33 is allowing individual users to either enable or disable electronic prescribing as well. So if you are a prescriber that may not qualify for electronic prescribing or doesn't want to use electronic prescribing, you can control that permission individually. Again, we go into tools in clinical. This time though, we select my options. And under the drug options tab, you can see enable electronic prescribing. That is at an individual user level. So if you're not intending to use it, you can just turn it off and you won't see the button there for you. All right, so now that we know that our practice has been set up, the feature has been enabled, we can go ahead and prescribe something electronically. So to do this, we simply find a patient, and we'll use Mr. Holloway here. Acknowledge any alerts that you need to acknowledge. And from that screen, you start your encounter. And this is stuff that you would do that depending on where you pick the patient up. If it's from the waiting room, the encounter would be started automatically. We'll go into drugs. And under the prescribe new drug section, we'll search for a medicine. We'll just do something as simple as a Panadol in this case. Once you've located the drug that you're looking to prescribe, you simply highlight it, and choose the Prescribe button to continue. Acknowledge the MIMS interactions report. So once you've scrolled through and it's all good, you can choose Prescribe to continue again. It'll take you through to the script details, which is really unchanged. What we have noticed though is that a lot of prescribers aren't aware of the dosage calculator and why it's important to use it if you can. A lot of people will just free text in here, which is fine. But if you were to use the dosage calculator, let's say 2 tablets twice a day, what it does do, it is updates the medicine estimated to last until field down the bottom. I'm not sure if you noticed, but previously it was red. If I clear that, you can see how it doesn't quite know how long the medicine will last for. But once we dose it up, using the dosage calculator, it'll give you an indication of how long that medicine is likely to last for. Now, really useful because in version 33, when we get to the next screen, you can actually specify a time interval between dispensation on repeats. So if you are intending on issuing repeats, and it might be a particular medicine where in your state you must limit the dispensation, let's say Schedule 4, you can use a dosage calculator to let you know what days that medicine is likely to last until. So on the topic of repeats, we're going to include repeats for this particular script. Let's say 2 repeats. So far, everything is the same as what we've normally been doing, with the addition, with the exception of the addition of this new button here, the Prescribe electronically button. So once I choose this to continue, you'll see the new electronic prescription screen. Worth going through this screen in some detail. The first point, or the first section contains all of the prescriber's details. You'll notice that our updated qualification is now listed here as well, followed by the patient's details, followed by the medicine that we're prescribing, together with any repeats that we want to issue as well. A couple of new additions to the electronic prescription screen. So if you have been using it, this will be new for you. The route of administration. So if you are prescribing a medicine that has more than one route of administration, you will have the ability to select the route that's applicable for this instance. So in this case, it's Panadol and it's oral, but you might have some drugs that have 2 or even 3 routes of administration. So use a drop-down box to choose. The notes for pharmacists is free text. So you are welcome to type something in here that is applicable to the pharmacist, bearing in mind though, that these notes may also be visible to the patient. So just be mindful of what you type in there. Under normal circumstances, you would have done a consult here with this patient. That clinical indication would be available for you to select using the drop-down box. So if you have specified one, you'd be able to select it. Alternatively, you are able to free text as well, and that'll just alert the pharmacist as to the clinical indication that that you're using for these particular medicines. So free text if you like. I mentioned the minimum repeat interval in days. So for a repeat, you are able to stop the dispensation based on time. So if you wanted to specify a minimum time interval, you are able to just enter in the days here. So that'll allow you to do that. Now, for certain medicines that you prescribe that require an authorization reference number, this is where you would enter that authorization reference number. So the terminology is different, but dependent on where you're based, in what state you're based. So in Victoria, and the system will update the wording here based on the postcode of the doctor. So in Victoria, if an authorization reference number is referred to as a warrant number. In South Australia, it's a permit number. In the Queensland and ACT, it's an approval number. Tasmania and WA an authority number, New South Wales NT an authorization number. So that will be updated based on your state. But this is where you would type in your authorization number if you have, if you are dispensing something using an authorization reference number. The third box is an unusual dose. Now, if it is an unusual dose, by checking this box, all you're doing is alerting the pharmacist to the fact that you have not made a mistake. It is intentional. Sometimes we know that pharmacies will dispense something and we will owe them a script. We've provided an easy way to do this in Zedmed version 33. So if you are owing a script to a pharmacy because it was dispensed due to an emergency situation, you can click on this box here. And what the system will do, it will allow you to email the electronic prescription straight across to the pharmacy. So you'll need to know the pharmacy's email address though. So it's worth knowing your commonly used pharmacy email addresses, and you can then just email that across in a matter of seconds. I know that'll save a lot of practices time because at the moment they're scanning and faxing, et cetera, et cetera. Now, from a patient delivery perspective, the patient will have two available options for token delivery, and that is via QR code by SMS or QR code via email. Unfortunately, they can't pick both. They need to pick one or the other. Now, if our patient demographic information contains SMS and email information, that will automatically be shown in these fields here. And in this case, our test patient has already got a mobile number listed. So it's probably worthwhile that, when we are checking patients in, we're just confirming that we have an email or an SMS already in their patient demographics. Having said that though, the beauty of electronic scripts is that the script can be sent to anyone. It doesn't have to be the patient. So if we're consulting with a patient that may, an elderly patient, say for example, and their carer will be collecting that script, or their carer has access to email and SMS, it's just a matter of typing in, over-typing the relevant number of that person. Now this will not update the patient demographic information. It'll only be relevant to this script and this script only. Okay, so from here, as I mentioned, you select either the SMS or the email that the patient requires. Now, you might come across a situation where the patient does not have either of those, or they don't want to access SMS or email. You do have the ability to choose no electronic token and then manually print out the QR code locally in your office and hand it to the patient. Yes, it does defeat the purpose of electronic prescriptions, but it is something that you might use depending on the rare situation. So they're the three options really: SMS, email, or print paper token. And I'll show you what these look like in just a moment. Alrighty, so for SMS, this is the message that will be received by the patient. They'll get an SMS with a link, and then when they open the link, they'll actually see the name of the medicine that they've been prescribed, the prescription date, and then any repeats will also be showing here as a supply remaining. They have the ability to copy the token and send it to somebody else if somebody else was collecting on their behalf. The beauty of the SMS and the email is that it's a live QR code. So if we were to cancel the script, dispense the script, and the patient was to click on this link again, it would actually update immediately, and it would move away from a QR code to saying something like, this script has been cancelled, or this script has already been dispensed. So patient management becomes quite easy. They know if this script is current, if it's been dispensed, if it's been expired, etc., etc. From an email perspective, they get, again, the QR code. Obviously it comes by email, and they just get a link, and once they open that link, they get the QR code, which I'm assuming would have to either display on their phone or print out if they were going into a pharmacy. So they're the two methods. From there, it's just a matter of choosing, and I'll just do an email 457. And I've got a phone number here, SMS, and I then continue by prescribing electronically. I'm getting this message because I'm not connected to a printer at the moment and I've chosen print paper token, but you shouldn't get that message. Now, I know it's successful because I can see here I have my medicine listed in blue, but also under today's scripts, I can see that the Panadol tablets have been listed, and I have this new icon here, which is our electronic prescribing icon, and that is telling me really that it's an e-script versus a traditional script. So as we start using electronic prescribing more and more frequently, you'll be able to differentiate between a traditional script and an e-script via this token. Now, a couple of things I want to show you on prescribing. The electronic prescribing feature is available to anything and everything. So there are no restrictions whatsoever to what you can or can't prescribe. So if we have a look at an authority drug, and I'll use an existing drug as an example, just to also show you that I can re-prescribe previously prescribed drugs now electronically. So if I look at the fentanyl here and I right click on that, I can do a couple of things. I can re-prescribe the drug and change the dosage if required, using the re-prescribed drug option or the prescribe new strength option. Or alternatively, I can exactly re-prescribe it by using the middle option, which is what I'm going to do now. Obviously, the system is doing some pre-checks in the background. Once it's done that, it'll take me through to the interactions report, which I acknowledge to continue. And here's the new button that we'll see. It's the confirmation whether we want to go ahead with the paper script, or this time around, we can prescribe it electronically, which is what we'll choose. You'll see the authority will come up, and you can continue with authority. It will ask you, because this is a Schedule 8 drug, it will ask you to re-authenticate by entering in your password, which is a new feature in version 33. So I'll just enter in my Zedmed password to continue. And it's just doing a couple of things in the background, and it might time out on me because of it's a Schedule 8 drug, but let's see how we go. So far, so good. We'll do and prescribe electronically. All right, so that was all successful. We can see here the fentanyl is now listed. We know it's an e-script because we can see the green e-prescribing icon. So that is an example of how you would issue something under authority or a Schedule 4 or 8 medicine. A couple of things I want to show you now is more around how to problem solve with electronic scripts. So the number one thing that you might, or issue that you might encounter, is that you might have a patient come back to you the following day or the following week and say, I've accidentally deleted my text or lost my phone, or et cetera, et cetera. The easiest way to work around that is to actually go back to the script that you've issued, and if we right click on that script, you can see here we can choose the cancel script option, which I'll select now, and it'll just confirmation is required, so we'll cancel this script. Alrighty, so now if we have a look at today's scripts, we'll see the fentanyl is still listed, but you'll see a red cross through the icon, the e-prescription icon, which indicates that that script has been cancelled. Now that script won't be deleted from Zedmed. It'll always be contained there for audit reasons, but this time, if, for example, the patient was to find her the mobile phone and click on that original fentanyl link, they would not be able to see a QR code. It will actually alert them that the script has been cancelled. To reissue that script to the patient electronically via SMS or email, you would simply go in to the script, right-click and re-prescribe it and push it out via text or email again. There is another option, and if you did have, and that is to right-click on the script and reprint the paper token. So if the patient was physically at the practice, this option would be suitable, where you could just reprint the token and hand it to them paper. But unfortunately, once you've issued a script via SMS or text, you cannot push that SMS or text out again on that one script. You'll have to cancel and reissue, which is, you know, it only takes a matter of seconds. So I don't think it's a bad workaround. So, so really, that is e-prescribing. You know, in Zedmed, it, as you can see, it only takes a matter of seconds to prescribe electronically. The great news is, as I mentioned before, that we are now in a position where we've got everybody working really hard in Victoria to enable practices and pharmacies. So you'll find that, you know, 2 months ago, we were quite limited in where we could dispense, whereas now I'm finding that most of the pharmacies that we engage with are electronic prescribing enabled. But there is no harm in just confirming that with your local pharmacies so that you know their current status. We will provide more and more updates as we get them with the other states. Again, worthwhile noting that if you are interested in electronic prescribing and you can identify a pharmacy that you can participate with, let us know and we'll put you on the community of interest program and you can start using that immediately. If you have, I have also collated many questions, FAQs on e-prescribing, but rather than going through them with you collectively in this webinar, what I might do is just upload them at the end of this session. There are some commonly referred to FAQs that might be of assistance to you. So feel free after this session just to go through them and just see if there's anything worthwhile there for you. But on that note, I might hand over to Fane now, who's going to cover off some other exciting enhancements in Zedmed 33. And I think she's starting off with the auto MIMS update, Fane.
Yes, thanks, Milton. Hi, everyone, and welcome to our Lunch and Learn this afternoon. I'm just going to quickly share my screen. Now, the rest of the session, I'll take you through the MIMS auto update, and then I'll also have a look at just the rest of the updates that we have for version 33. Now, before I start, I just want to point out something. I did send through the links via chat, but if you jump onto our website and go to help, now I've put a link here to version 33 and we've got automatic MIMS update and we've got e-prescribing. So if I go into, say, auto MIMS update, I just want to point out when you get to this page, we'll set up some recordings just to help you and on the left-hand side, you'll see there's a menu. There's a menu list on the left-hand side, so you can now go through it as well. And that's the same with if I am to click on electronic prescribing. This is where Milton will upload the FAQs, which is the frequently asked questions, and you'll find lots of recordings on the left-hand side here. So I'll take you through. Now I'm going to take you through MIMS update. So good news with version 33 and the hard work of our development team. For this version, you can now do MIMS update from your machine. So it doesn't have to be on the server. It can be from any workstation. Now, in terms of who have access to upload, to update MIMS, that depends on the role itself. So as an example, by default, when you upgrade from any version to version 33, you'll find under the roles of an admin. So if I'll go to a role of an administrator, if I expand to the right-hand side, we have included functions. So if I expand this, we have update MIMS. So if you're, that means only staff members with admin logins can do the update. If you want to give this to a doctor, for example, to do, it's just a matter of adding that in. So on the left-hand side, if I expand this, so on the left-hand side, you'll see update MIMS, and then you can move it to the right-hand side and add it to that doctor's profile. So what that looks like in Zedmed, if I just go to clinical. So in clinical, you'll get, if you're a admin user, or if that MIMS update's been added to your role, you'll see a notification here up the top in yellow. If this disappears, that's fine. It does refresh and it'll come back. If you want to know what current version of MIMS you have, you can simply click onto MIMS, and currently I have, so up the top here, if you can see it, I've got August. So I've got that notifications, and then I also have under tools. So there's a new menu under tools for update MIMS. If you ever miss the notifications, you can click on update MIMS, and that should run through and do the update for you. Now, if I'm to click onto this notifications, it'll give me this screen. So you've got the last update, MIMS August, and if I click update MIMS, it'll ask you for your password, which most will have this password on hand because it'll be sent to them via email by MIMS. Now this will have no, and I'll just click OK, and click OK. And then you'll see up the top, it'll run through, it'll give you a status bar as it's doing the update. This will have no impact in terms of clinical, so doctors can still prescribe. They don't have to close out of clinical for this to work. It'll just automatically refresh. So if I close this window here, I can see up the top that I've updated my MIMS 100%. And then it should reflect, because it's my test system, I played around with the data, but what I should see now here is MIMS September. So you have this new status bar for MIMS. So that's the new feature for version 33. The other one I wanted to talk about is security settings. You can now set a time around if you want to automatically lock Zedmed, lock a user out after, just like your computer, when you walk away for 5 minutes, it locks, which means you have to log in. So under the practice and security settings down the bottom here, you'll see these options comes out. So by default, we turn them off. If it's something that you like to enable, you can do so. Now, some of these new features here, so you can have a maximum password retry. So if someone's entered their password more than 5 times, they're going to be locked out. You can set the password interval. I think that was there already. Reuse the interval. So basically means you can reuse the same password, whether in 90 days or outside the 90 days. You can also have the option to, if any person have left after, say, 90 days, you can specify the dates here. It'll just automatically make them inactive in the system. And this is the settings I mentioned earlier, so you can lock the program if it's been inactive for an X amount of minutes. In terms of the locked out, so maximum password retry attempts, what will that do is that it'll lock out a user, and then they will need to go and see whoever the admin person is. It'll automatically make that person inactive. So you'll, as a practice manager, for example, or whoever the admin person is, will then go through the list of users. So if you don't see that user here, you're going to have to look for them under the inactive users and activate them through that way. So if they are an inactive user, for example, you can make them active this way, and you can make their set their password as well. So that's the security updates. The other thing also in version 33 with SMS, so under branches and options, Now with our SMS, we now have, you can set up with Inspiris. So we do have some clients who were with Inspiris. So if you're looking to set up two-way SMS with this provider, you can now do so in version 33. So that's what few main things that you can actually do in version 33. I think the note itself, so if you get a hold of the release notes, you get to go through some of the things that's been fixed on this version. I think, Milton, that's all I have for now. Any questions from our audience today that you'd like to go over? No, we're good. Now we have this session recorded and I'll have it uploaded onto our website. It'll be on our website by tomorrow. So to find our recordings, you can go into support and training, and we have lunch and learn here where all our recorded sessions are located. But feel free to go onto our help section and you'll find Zedmed version 33 right in the middle here. We've got auto MIMS update and e-prescribing. Yeah, I think that's all. That's for our session today. Any questions? Oh, I've got a question coming through now. I'll just quickly have a look at what that is. I think this is a question for Milton. So that's with pharmacy email address, do these need to be manually input each time, or will there be a favorite or drop down list?
Hi, Michelle. So yes, they do need to be updated each time, because as you can imagine, there are thousands and thousands and thousands of pharmacies in Australia. It would be impossible to have a drop down. So what I've been suggesting to practices is just to maybe just do a bit of a cheat sheet where your GPs can just have a couple of the really common pharmacies listed on their monitor that they can make reference to.
And I've got another question here for you, Milton.
Yep.
How many drugs can you prescribe per electronic script?
Yeah, great question, Kerry. So with a script, it's one drug. Now, what I didn't mention is with repeats, the patient will only have one QR code. So let's say you're issuing something, a drug with 4 repeats. They're not going to get 4 scripts. They're only ever going to have one QR code. When they go to the pharmacy for the first time and dispense, and they get their first medicine, the pharmacist will push the subsequent QR code out, and they'll go and get their repeat. But it's one drug per script.
Awesome, thank you. I've got a question here and I can answer that for you. So does the practice manager have to download the MIMS files from email, then upload it to Zedmed, or Zedmed automatically has the MIMS update files there? So with version 33, the Zedmed download the MIMS file for you, so you don't have to do anything other than adding in the passwords basically. So the way that works is that when you upgrade from say version 31 to 33, there's a additional stuff that's been added to the database just to automatically grab the files for you. So the only thing you need to do is enter the password. Now I've got one other MIMS questions here about MIMS. So the practice manager can do the update and it pushes to all users. Yes, that's right. In terms of this notification that comes up here, you can set which user in the practice who can do it. But once a practice manager update this, say from their workstation, it'll be updated to all users in Zedmed.
So Kerry asked me whether patients had to have a My Health record. Yes, absolutely. So it is only e-prescribing is only available to patients with a valid IHI, and we all know that they're patients that are part of the Medicare system. So no IHI or no Medicare, no e-prescriptions, and actively registered with My Health record.
What are the other registrations required for e-prescribing?
Yeah, so I can, they're quite lengthy. Is that you, Demith?
Yes, yes.
Yeah, I'll email the. Can you send me your email and I'll email them across to you?
Yes, yes. Okay. So which email I have to send my email?
implementation@zedmed.com.au.
Okay, yeah.
Awesome. Any other questions before we wrap up? No? Well, thank you everyone for coming to our sessions today. Like I said, we're going to update it online. It'll be there tomorrow and you will have access to it. And as always, you have our email address. If you have any feedback or if you'd like to book any training with our team, feel free to let us know. Other than that, enjoy the rest of your day and thank you for coming. Thanks, Milton.
Thank you, everybody.
Thank you.
Enjoy the rest of the afternoon.
Thanks.